Hey, welcome to the Go-To Physio Podcast. My name is Dave O'Sullivan, and in this podcast, my aim is to give you 15 years of my experience in professional sport and private practice and share that knowledge so that you can get real-world results with your complex patients who have failed traditional approaches. I hope you enjoy the show. Hey, welcome to episode 39 of the Go-To Physio Podcast, or for 2023, this is episode 7. Now, today I want to talk about 3 critical clinical reasoning questions that's going to really help you make sense of your patient's story and then ultimately make sure that you get that result for that patient that's going to have a happy progressing patient. Now, as always, we have 4 types of episodes on this show. This episode is going to be a HPP episode, which is a happy progressing patients episode, which is where I go into a key concept from my book, Happy Progressing Patients, and help you going from knowing this content to really understanding it. The second type of episode, it's just going to be more of a Q&A type episode, which we're going to have quite a few of those coming up. If you want to get your questions answered on the show, then you just head over to thegotophysio.com/questions. The third type of episode, it's going to be more of a traditional episode where I'm going to interview somebody. But the one thing I will say is that episode will have very practical applications. Knowledge is not power unless you can take your knowledge and apply it in the real world with your patients and see results. Okay, so I'll make sure that those episodes are very practical for you. You're not just sitting there for an hour and you're getting more and more theory, because I think that's half the problem is people have so much knowledge these days, but they're struggling to implement it in the real world. And then the fourth type of episode is more of a topical issue. Okay, and that's where something might come up from my mentorship community or something else that I feel is actually important, and we'll discuss that in a little bit more length, okay? But as I said, today we're all about the key 3 questions that I talk a lot about in the Happy Progressing Patients that's going to help you make sense of your patient's symptoms. So what we're going to talk a lot about now is page 47 on Happy Progressing Patients. Now, in that I talk about, obviously in that chapter, I talk about second order thinking, I talk about second order consequences, stress and reactions to stress. And then the other concept I talk about is the motor adaptations literature, which we've gone into a lot more detail in previous episodes of the podcast over the last few weeks, okay? So now, page 44, I talk about, in addition to second order thinking, I became interested in the power of asking yourself better questions to help focus your mind, okay? Now, I think that's a really important point. Now, I always say this to mentorship therapists when they come on the mentorship program, is a lot of what I'm doing with you is I'm helping you focus your mind. And that's one of the biggest things that I think therapists really struggle with, is we have this scattered approach where our mind is just hopping and we're going from one thing to the other. And that real inability to focus is actually, it's probably a problem in this day and age. And I certainly notice it from my kids as well. The ability to actually focus on one thing, it's definitely decreased. And I know there's, people will say these days we can only focus for a certain amount of time compared to what we were in the past, okay? Now, it wasn't until later I got real clarity on the power of questions from Keith Cunningham, okay? So he was a business coach, and his book, The Road Less Stupid, that helped me a lot, okay? So I'm big into mental models also. So the other guy I want to give credit to is Shane Parrish, okay? So he wrote the book, Mental Models, and that's some really, really good stuff. So the kind of backstory to all of that was I'd left Huddersfield Giants. I was going out in my own private practice, and then I kind of had an ability to see more athletes from different teams and stuff like that. And what I noticed was I was actually starting to get a lot more athletes come to me. There was a lot more pressure as well to get results. So I remember I had one professional rugby union club, an athlete and a physio travel over from Ireland to see me. And obviously there was a bit of pressure there. And, I had to get this guy results. He traveled all the way over with the physio. So it was at that time that I really started to define the root problem, but also give myself tools to help me focus. And that's where I started to go, okay, I need to focus better in these sessions. What are the tools that I can use to focus? And that's where I started to get really interested in this stuff. So one of the big things that I mentioned in the book is that very often the person that brings the problem very often defines the problem. Now, we can use this in all aspects of life. It's not just physio, okay? But very much Shane Parrish went on to say that very often the patient, is coming in. Okay, now he's not obviously talking about back pain patients. I'm making this more applicable to you. And a patient comes in and they bring the problem to you. I've got back pain. Okay, so they come in the door. Oh, I need help with my back pain. So the person who's bringing the problem very often defines the problem to be solved. So then we naturally go, okay, you've got back pain. I need to solve that problem for you, your back pain. Whereas actually what we found is that Shane Parrish encouraged you to say, am I accepting the patient, or, and I put in the book as well on page 48, or the doctor's definition of the problem, because sometimes you might get a referral, okay? Or is this actually just a symptom? So is the problem back pain, or is that the patient cannot do certain tasks because of the back pain? Now, I think that's really important as well. Point in the book is understanding that actually the back pain isn't the problem in the first place, is the back pain's causing the patient to have problems, okay, that they can't do. And we've all probably had back pain in the past, and a lot of your patients have probably put up with back pain for years almost, and then it comes to a pivotal point where the pain has stopped them from doing something, or it's just got to a point where they can no longer do something. That's the thing that drives that ultimate motivation to then come and actually see you, okay? So I think that's a really, really important point. So the first step is to ask yourself, when a patient comes through the door, is this a symptom or is it the root problem? Okay. And asking yourself that question, okay, I think it's really good to help you focus. So is the back pain the root problem, or is it a symptom? Okay. Now the next step is to ask yourself, what would be true for this problem to not exist in the first place? Now I think that's an incredibly powerful question to really focus your mind. What would need to be true in order for this problem to not exist in the first place? Now, probably by now I'm a big fan of Louis Gifford's Aches and Pains. Now, he talks actually a lot in his book about a shopping basket approach. And if you look at his case studies and how he treated patients, again, I'm probably slightly different to him now, but I think we probably agree a lot more than we disagree. Okay. But one of the big things he calls it a shopping basket approach, where he looks at the assessment, he goes, okay, and he figures out things that maybe are problems for the patient, but also he looks at what's not doing its job almost indirectly, okay? So what would have to be true for this problem not to exist? So I think he done a really, really good job of that, and or certainly communicated that in his books. So when we look at, and I use the case of an inflamed knee joint in the book, what would have to happen to make that knee joint not get inflamed in the first place? Okay, well, if we look at that from a simple point of view, from a running point of view or a deceleration point of view, when that foot hits the floor from a deceleration point of view, because I'm treating a tricky patella tendon issue at the moment with an athlete, okay, and his physio, so this is just popping to mind. What would need to be true so that he wouldn't get that irritation when he decelerates? Well, the first thing we need to know is what should happen when the foot decelerates. So again, looking at the literature, we know the soleus needs to take a lot of force when that foot hits the floor. And we know the quads also need to absorb a lot of force. So if we had the quads and the soleus doing their jobs, would that tendon be a little bit happier? Probably yes, it would. Okay. Now, the nice thing about this here is we start looking at the person in front of us, and then you're designing a very different treatment plan to just going, okay, it's a patella tendon point of view. And again, without knocking the physio, his approach at the start with that athlete was, okay, the tendon, it's thickened, it's irritable. We need to do loads of eccentric loading on the tendon. Okay, but we didn't appreciate actually how the quad and the soleus have to interact together and direct that force. And then also the hamstring and the hip are going to be very important as well to take that joint ground reaction forces away from the knee joint. Okay, so the third step then is to ask yourself, would this solution pass the test of time? Now, I think that's an incredible question also. Would this solution pass the test of time? Will this problem just pop up again for the patient in 3 months, 3 weeks, or 3 years? So for example, with the inflamed knee joint, if I just treat the knee joint and help it to settle down, what happens when the patient goes back to real world activities? And this is very much, I see this stand out in pro sport, okay, where athletes continue to break down again, okay? Because again, if we're just treating the symptoms, most patients' time will settle symptoms anyway and rest. Okay, not a rest for everybody, but just a little bit of deloading, a little bit of time, things will start to feel a little bit better. But then when they go back into the real world, they start to break down again, okay? So I think this is an incredible question also. So when you design your treatment plan, you ask yourself this question to see, is there anything that I'm not seeing or any gaps in my rehab plan design, okay? So will this pass the test of time? So for example, let's say for argument's sake that patella tendon issue, the soleus and the vastus lateralis weren't absorbing a whole lot of load now, so the tendons get a bit grumpy. We give that patient some isometrics, we give them some eccentric loading through the tendon to get some load through it, okay? But actually, if the soleus isn't doing enough work and we haven't addressed the soleus, now I'm not saying strengthen the soleus, I'm talking about the timing of the soleus and the quads working well together. That's a completely different thing to just isolating the soleus and hoping it's going to carry through. And I'll talk about that in a completely different podcast, okay? So if we didn't address that ability of the soleus and the vastus lateralis to work well together when we decelerate, and then I put them back on the pitch, is it realistic that actually that knee is going to stay happy, okay? Will it pass the test of time, or will that irritation potentially come back again, okay? Now, from my experience with these, there's two things going to happen in that scenario, okay? Probably three, to be fair. Some people, they get away with it, but they're not quite the athlete they were previously, okay? Because they don't have thoughtless, fearless movement. They're adapting, they're using strategies to work around it, okay? But that catches up with them. Those milliseconds, they catch up with them, and they're not the athlete they were. The second scenario is that actually the irritation comes back again, okay? And then the third scenario is that the more classic motor adaptations, then they start to pick up, okay, my patella's all right now, but now my Achilles starts to get sore, okay? So again, they just load somewhere else in the body, or the other tendon gets sore, okay? So the left one's all right, and then they start overloading the other leg to decelerate more or whatever. And again, that's just from my own clinical experience, okay, or certainly my observations, okay? So this is one of the biggest mistakes I see all the time, especially when I consult with pro teams. I say in the book, the therapist and patient spend so much time and energy on all the evidence-based rehab, okay, in the literature, okay? And again, I'll talk about the 80-20 rule next week. I'm not saying you don't look at the tendon, okay, and we don't appreciate that, and we don't do isometrics, we don't do some slow loading for the tendon. I'm not saying that. But that to me would be 20% of our approach, okay? The 80-20 rule, the Go-To Physio 80-20 rule, 20% of our time on the symptoms, 80% of our time on what's not doing its job, okay? On paper, we're doing everything right, but it doesn't address the root problem, so the patient stagnates and when increasing load on the injured area. So settling the knee joint will solve the problem for a few weeks until the patient increases the load again. Solving the hip or hamstring or soleus issue that wasn't doing enough work in the first place will solve the root problem. So when the patient goes back into the real world, everything is doing its job. Do we completely ignore the symptoms? Not at all, okay? So again, I'll talk about that in the next episode, how to use the 80-20 rule with some more practical experiences, okay? So I think that's a really powerful 3 questions to ask yourself with every patient. Am I solving the root problem, or am I solving the symptoms? Okay, because again, for a lot of patients with back pain, for example, the root problem for one patient could be a lack of ribcage mobility due to emotional stressors, which we talked in previous episodes. Another patient, it might be a lower limb issue that they're not loading their leg well enough. And for another patient, it might be actually that they're not loading their upper limb enough. Okay, so again, then their iliocostalis, the rib cage, all reacts, and then over time that catches up with them a little bit and contributes towards that pain experience. So the most important thing is that we look at the person first, pain second. Everybody's going to have different previous stresses, which we know from the motor adaptations literature, which I talked about in episode 37. Okay, we know that there's no known predictable response to a noxious stimulus, that everybody reacts slightly different because we all have different stories. So we have to understand, make sense of the symptoms, what's driving the problem, what's not doing its job, that if it was doing its job, this would no longer be a problem. And then when we design the treatment plan, we have to ask ourselves a critical question: will this solution that I'm designing, will this treatment plan that I'm designing, will it stand the test of time? And I think there are 3 incredibly powerful questions to help focus you. Am I treating the problem or just the symptoms? What's not happening, that if it was happening, this would no longer be a problem? And is my treatment plan going to stand the test of time? Okay, 3 very powerful questions that you can implement this week. Okay, as always, if you enjoyed the show, there's no advertisements or anything like that on the show. Okay, if you enjoy the show, please share the show. Okay, I think the physio profession, it's all very competitive, and ego and I'm better than you and my way is better than yours. Let's all work together and actually help each other. If you have a colleague that you think will benefit from this, then pass it on, because ultimately the only people that are going to benefit from this is people in pain, okay? Because the better we are, the more clarity, the more confidence we have, the ability to make sense of patient symptoms, the ability to get buy-in, adherence, retention, and the ability to keep patients progressing. The big winner there is people in pain who have failed traditional approaches. So I'd appreciate if you enjoy the show, share the show with colleagues, and if you want to go one step further, do me a massive favor, pop a review on the podcast. That just helps get more awareness for it. Okay. If you want your questions answered on the show, head over to thegotophysio.com/questions. If you want to pick up a copy of the book, thegotophysio.com/book. The special project that we're working on, which we're about to launch shortly, thegotophysio.com/members. Okay, if you're not quite ready for the mentorship, or if you want to get a structured step-by-step system that gives you the clarity and the confidence to keep any patient progressing, and also answer the 4 post-work questions to your patient. What's the problem? Why did it happen? What's the plan? How long is it going to take? And then ultimately keep on progressing all the way to the final session. You want to do that in the most simple and direct path, then head over to thegotophysio.com/mentorship. And then you can schedule a call myself or Shay, my head physio. We'll show you around the program, see if it's a good fit for you, or we'll answer all your questions. Okay, that's it for this week. As always, solve the biggest problems for your patient. The back pain is causing you patient problems. Focus on that, put that at the forefront of your treatment plan. Make sure that you're looking at the root problem. Make sure that your treatment plan is going to stand the test of time for your patient, and that ultimately we're addressing the things that if they start doing their job, this problem would no longer be a problem. Okay, that's it for this week. Have a great week ahead. We can make a massive impact on our patients' lives, as I said, with just a little bit of critical thinking. Knowledge is not power unless you can take all your knowledge and apply it in the real world and see results. Okay, I'll see you next week.